Penile implants have come a long way. They really have. When I first started in this space, the outcomes were much less positive than they are now. As a matter of fact, I feel like back in the day, most people who got them at some point were like, oh gosh, should I really have gotten this? And I feel like now patient satisfaction with their implants are a little higher than they were back then because the technology has changed. But I got two different questions. One from a gentleman who has one and feels like he should get it removed because he's kind of doubting the situation, and another gentleman who's just kind of asking, saying he has one and what type of information I could give to help him. So once you have a penile implant, pretty much the implant takes over. It becomes erect for you. You don't have to have erectile tissue that's going to perform in any way, shape, or form. It does it for you with a push of a button. And when you're 70, and whether you have an implant or not, now is the time to do a little bit more what we're talking about, shifting a little bit in thought around sex and relationships. Because here's the thing, it's like anything else. What works for us in our 20s and our 30s and our 40s is not going to work as well for us in our 60s and 70s. And I'm not just talking about the erection, I'm talking about your technique, what you're actually doing when you're in the flows of passion, right? Because optimally, when it comes to sex, you not just want to do your best and perform your best and feel great. You actually want great feedback from the person the next day, right? Or a few hours later. The best scenario is, man, that was fantastic. You laid it down. I can't stop thinking about it. Wow. Like, wow, wow, wow. You want to blow somebody's mind, right? So I feel as though as we go up the ladder and we're in our 70s, you've got to shift a little in your thought about what sex is and how to pleasure somebody. And you've got to be more willing and more open to try new things and to take on the risk of doing some things that maybe you haven't done before. So for instance, a lot of people are like, vibrator, you know what? You've been using a vibrator? Listen, that's what I'm here for, right? Why would you use your vibrator? But let me just change your thought, give you a little nugget to change that a little bit. I want you to think of a vibrator as your potential helping hand, your buddy, your friend, right? So it's like anything else. Michael Jordan couldn't have won as many championships if he hadn't had Scottie Pippen, right at his side. So you gotta start to evolve your thought process, and you'll do good if you do this earlier in life as well. You have to start evolving your thought process. So it's not all about you and the D, but it's all about you, your hands, your mouth, your best friend, potentially a vibrator, coming up with romantic situations, finding new places to do it. You want to weave creativity into your sexual routine, or else you become stale and people become bored and you become bored with yourself, right? It's not supposed to always be in the bedroom at bedtime with the TV off, with the TV on, so start to think outside of what it is that you've been doing for the past 70 years, 60 years, 50 years, 40 years, and push past that into some stuff that maybe you haven't tried yet. And I find that most gentlemen haven't even thought about getting a nice, decent vibrator and have it sitting by the bed so that it can take up some of the heavy lifting, right? And not only does it take up some of the heavy lifting, it just infuses more fun and energy into the situation. You can use it on yourself. A little nugget that you may not realize is that if you take a vibrating object and put it on the frenulum at the base of where the corona meets the shaft, if you place it there, you can actually start to get an erection whether you are turned on or not. So for instance, gentlemen who've had spinal cord injuries, one of the ways that we can actually elicit an ejection of sperm so that they can have some to get somebody pregnant or what have you is by using vibration either at the base or at the tip to get things moving. So for instance, if you're in a situation, things are hot and heavy, but you're looking down, you're like, oh gosh, not really doing what I wanted to. If you had the vibrator available, then not only can you help your partner get there, but you can actually help yourself get there. So I think as you get older in life, you want to start to be a little bit more creative, because creativity becomes your best friend. Now, the gentleman who messaged me and is wondering, okay, so his message, and I can't find it off the top of my head here. His message is basically around the incidents of, hey doc, I've had this implant placed. I'm young. And now I'm doubting whether or not I needed it. And he's basically telling me that he's had some doctors tell him that he could probably get erect without it. And he's asking whether or not he should get it removed. And really, I could feel in the message the pain that he's had associated with this. It's been a kind of a painful experience for him, and he really does not want the implant anymore. Now, anytime you get an implant in your penis or get it removed, that is a major surgery. So once you get it placed, it behooves us to just become comfortable and confident with it and put it into the regimen. But I can tell from your message that this is bringing you so much angst that in your case, it may be worth removing. I will say this, though. There is no guarantee, there's no test that any doctor can run that can tell you whether or not if you remove that implant, your erections will go back to normal or that they will be sustained. There's no real guarantee there. So if you remove the implant, you run the risk of two things. One, that you may not get the erections that you want once it's removed, but you also run the risk of still being kind of depressed even after they remove it. So if you have a situation that's making you feel depressed, you have to know that what you think is making you depressed may not be what's making you depressed. So whenever you're feeling depressed and you do big things like go get an implant, go get some breast implants if you're a lady, any type of implant, you really want to do the psychological work to figure out what is making you depressed in the first place. Because oftentimes a decision like that is a Band-Aid on the real pain that's underneath why you were feeling depressed and got it in the first place. Okay. So like a former consultant, like Ken Schaefer, let's talk about Ken Schaefer. He just wrote an amazing book on erectile dysfunction and his journey from erectile dysfunction to erectile function. And Ken, I remember, was at the point where he's like, Dr. Rachel, it's been 6 months. Should I start thinking about a penile implant? And after working through all of that, trying new things, he's got erectile function back, and he was at the point where he was considering a penile implant. So I want those of you who are considering an implant to really slow down a little bit and figure out what can you potentially do to improve things. My thoughts on penile implants are this, that basically if you can try everything, then you actually should before you go with the process of putting an implant in there. You see if I have that question, if I can pull it up really, really quickly. Because here's the thing, once it's in there, you cannot turn back. This is an implant. And I don't know if you've ever seen a lady who's gotten some type of implant and doesn't like it and doesn't want it, or it's causing inflammation. A foreign object in your body does potentially cause a myriad of risks. So before you do an implant, I want you to pump. I want you to try Shockwave. I want you to try PRP. I want you to try boosting your nitric oxide levels. I want you to try improving circulation, improving your overall health, getting your diabetes under control, getting your hypertension under control, doing the work to heal the blood vessels that are supposed to go to the tissue to make an erection. I want you to do all of that before you would consider, going and doing something like that, because that is a huge deal. And as you can see from the messages, it's not always what it's painted out to be. Okay? Awesome.